Hello, my name is Megan Pechtel, and I am an OPN to RN student at Unit Euler. I'm going to be talking about my CSI reflection today. I really enjoyed the CSI. I learned lots. It was very interesting to see the different mental illness diagnoses and to just have the experience to be able to communicate, learn how to communicate, and how the best way to respond when some of your patients are having a mental health crisis. I'll go ahead and start with the questions. Number one, some of the therapeutic techniques that enhanced my communication would be active listening, open ended questions, silence, and reflection. I felt like these techniques um, helped the patients feel heard, and it felt them to encourage their thoughts, especially with the active listening. It made them feel more comfortable to talk to us, giving them the silence to think about what we are talking about and giving them ample amount of time to respond also uses good therapeutic communication. Number two, some techniques that hindered my communication was definitely I showed nervous body language, such as wringing my hands, putting my hands in my pockets, putting my hands behind my back. That can show your client or patient signs of nervousness, and it is also bad body communication, especially putting your hands in your pockets with some of your bipolar, with really any of the mental illnesses. Some people can see that as you're hiding something from them in your pockets, and that can make them even more scared and closed off to talk to you. So, that is something I need to be working on with my communication. Three, I felt very sad when my patient cried, very empathetic, and made me want to hug them, but you have to set up boundaries. I also felt nervous when they showed paranoia, but I did my best to stay calm and try to make the patient feel safe by reassuring them and listening without judging. Four, I used critical thinking by asking how the patient is feeling, by follow up questions, and prioritizing safety, such as blockading the door so that they could not escape, um, keeping keeping my distance from the patient, but also being there and letting them know that we are there and that they are safe where they are at, and reorienting them to where they are at is very important as well. Five, my verbal and nonverbal cues. Um, I did well with my tone of voice. I kept it very calm, very, um, I would not say monotone, but very empathetic, I feel like. I noticed changes in mood. I kept my facial expressions neutral, and these cues help me identify my patient's priority needs, as patients will feel more comfortable the more relaxed you are, and your tone sets the mood for everything. Six, this the CSI experience has definitely changed my feelings towards mental illness. I have learned that patients with mental illness deserve patience, respect, compassionate care, someone to listen to, and just to really open yourself to them and let them know that they are safe where they are at, and get them to be comfortable with talking to you. Seven, overall, I was pretty much happy with my communication skills. There are definitely some things I could work on, such as following up with some of the questions. Um, I know that with my depressed patient, um, I did pull up the chair and I asked him how it made him feel and describe his emotions about the sertraline. I needed to follow up with if there's anything you want to talk to us about. That is a wonderful question to keep the conversation going, because he was very closed off and did not necessarily, he was very down and gave us very short answers. So trying to get him to open up is important. Um, with my alcohol withdrawal patient, when asking when her last drink was, need to follow up with the appropriate questions with that. 8, confidence with the mini mental status exams. This experience made me more comfortable completing the mental status assessments. And I feel like through clinicals and being with these patients, it has given me the confidence to ask more of these sensitive questions. Um, Number 9, the main thing I learned during simulation was that their therapeutic communication is most important. Your body language and how you assess the patient is very important. So staying calm. If the patient's sitting down, you sit down, but still give them ample amount of space. Don't sit too close to them. Um, Using my hands, such as putting them to my side or putting them in my lap, to not wring my hands, put them behind my back, and to not put them in my pockets, to maintain eye contact, and to because that will build that trust and that trust rapport with you and your patient. So body language and communication is everything. 10, my main takeaway was that I need to pay closer attention to my nonverbal communication, use more open ended questions, and always prioritize patient safety. Um, I also learned that setting limits while remaining respectful helps build trust. Um, with my depressed patient, I set at eye level and I allowed silence and encouraged the patient to express his feelings. And with my alcohol withdrawal patient, I did I need to ask about the last drink, monitor those withdrawal symptoms, and focus on safety. I need to better assess when they are going into the seizures. I needed to lower the head of the bed, turn my patient sideways, get O2, start the O2 up, start the oxygen up before I put it on before I put it on the patient. Then I put it on the patient, get my suction ready, and you cannot put it in their mouth. You put it on the side, and that is something that I will be working on with my alcohol withdrawal.